At the Global Advisory Alliance, we bring together senior practitioners, executives, and advisors to explore the strategic challenges shaping organizations across sectors. Healthcare, for today, is continuing to face significant change. Artificial intelligence is transforming clinical and operational decision-making. Cyber threats continue to grow in scale and sophistication, and organizations are adapting to workforce pressures while maintaining high standards of patient care. Today's discussion is an opportunity to hear directly from leaders who are working through these challenges and to share practical perspectives on building resilient, future-ready healthcare organizations. The title of the session today is Leading Through Healthcare Disruption, Building the Future-Ready Healthcare Organization in an Age of AI, Cyber Risk, and Workforce Transformation. With that, I'm delighted to introduce our panelists. Akshay Patel is the Interim Chief Executive Officer of the College of American Pathologists. As Interim CEO, Akshay leads one of the nation's most influential healthcare organizations, representing more than 20,000 board-certified pathologists and advancing excellence in laboratory medicine, quality, and patient safety. As the leader of the world's largest organization of board-certified pathologists, Akshay is focusing on advancing excellence in pathology and laboratory medicine while helping healthcare organizations navigate rapid technological change, evolving quality standards, and the growing role of digital innovation and AI in patient care. Robin Devine is the president and CEO of TriCore, which drives the organizational growth strategy and vision to become an indispensable partner in shaping the future of healthcare. She cultivates a culture that inspires employees to take pride in their work and encourages patients to choose TriCore for exceptional care. With over 30 years of healthcare experience, Robin has led transformative initiatives and strategic expansion. A graduate of the UNM Anderson School of Business Executive MBA program, she is deeply committed to serving her community and advancing innovation in healthcare. Dr. Philip McAdoo is an organizational strategist, educator, author, advocate, and storyteller whose work focuses on trust, culture, workplace well-being, belonging, and systems change. He serves as the Director of Internal Equity and Workplace Well-being at the Institute for Healthcare Improvement, where he supports leaders and teams in strengthening the human and organizational conditions that make improvement possible. As host of Turn on the Lights, Philip brings a human-centered and systems-focused lens to conversations about what healthcare needs now and how better systems can be built. Susan Pasley is the Vice President of Nursing at Carebrain. A healthcare executive and practicing emergency department nurse, she brings more than 2 decades of experience spanning clinical care, nursing leadership, patient experience, healthcare technology, and workforce strategy. She previously served as Chief Nursing Officer at Carebrain, where she advised healthcare executives and industry leaders on nursing workforce innovation, artificial intelligence, and the future of care delivery. I'm Matt Hartzman, a founding advisor of the Global Advisory Alliance, and I'll be your host for today. I've spent more than 30 years leading organizations' growth and transformation through leveraging technology, managing technology risks, and building tomorrow's leaders, mostly in healthcare. 3 years ago, I started Hartzman Partners, a consultancy for boards and executives in healthcare focused on technology risk management. You'll find today the themes are around innovation and resiliency. Please put any questions you have in chat and we'll save some time towards the end. Also, there will be a replay and key takeaways provided to all attendees afterwards. With no further ado, I think I'll start the questioning. Akshay, I'll start with you. Healthcare is embracing AI and digital technologies at an unprecedented pace. How is CAP evolving its quality standards to help laboratories innovate responsibly?
Thank you, Matt, and thanks for having me here. So one of the CAP's greatest responsibilities is ensuring innovation improves quality and patient safety, not compromise it. Everything we are doing is to make sure we are continuing to improve quality and patient safety. As our laboratories worldwide, we are in more than 100 countries, as they adopt digital pathology, AI, advanced molecular diagnostics. They're doing a number of things to advance the testing they do in their laboratories. At the same time, we want to make sure as they're advancing, CAP's standard must evolve at the same pace. Well, we have to keep up. And our approach is to be both rigorous and forward-looking. We want to make sure we continuously engage with our practicing pathologists, our laboratory leaders, subject matter experts to make sure our accreditation standards and proficiency testing program kind of reflect emerging technologies. Remember, we have two flagship products. We do accreditation of medical laboratories worldwide, and we also provide the proficiency testing to make sure every test they perform, they are doing what they need to, and our proficiency testing program makes sure that happens. So as laboratory kind of implementing those emerging technologies, we want to make sure that we are there to support them with implementing innovation. That's very important. So we have kind of making sure that our commitment to those laboratories that they have the appropriate standards, tools, practical guidance, and confidence to validate those new technologies. It's important. There are a lot of AI is being applied in everywhere, especially in medical laboratories. So we are making sure that innovation cannot compromise the trust, which is super important. So we are making sure that we are delivering evidence-based standards, provide the education and peer-driven expertise. As you said, Matt, we have 20,000 plus members. We are kind of bringing that community to make sure that we are educating each other kind of from their experience, how they are innovating, what they are doing, how they are applying some of the standards. And so we are doing, CAP is doing a number of things to make sure we are providing all the tools and subject matter expertise. Your second part of the question is how the leaders should kind of decide whether innovation makes sense or not. In my opinion, we shouldn't do innovation just to do it. It got to improve the patient outcome or quality or access to care. You just can't just do it to do it. And the way we look at it, in my opinion, innovation investment, all innovation investment should answer a simple question. Does this create meaningful value for the patient or my lab? You got to answer that question and then say, okay, all right, well, this innovation makes sense. So I think one of the things we are kind of very particular about it is the innovation and the quality go hand in hand, right? So we are trying to implement the quality with the whole innovation process from the beginning. So as they're implementing new technology to make sure they're evidence-based, clinically validated, we have ability to continuously monitor to make sure they are safe, effective, and there is a trust in that. So when you tend to put the patient first, and make sure there is a governance throughout the innovation. You put quality and governance according in the beginning of the innovation process. I think we want to make sure there are checks and balances, and quality and governance really complement. So I would say look at whether it's creating meaningful value for patients or clinicians who are working in the hospital, and if it's creating meaningful value, Matt, then I think that's the innovation you should invest in. So that's how we are looking at things, rather than we have a long list of innovations to do, but we've been very particular about kind of looking at what value it's going to bring, how it's going to bring more safety, trust. So a number of things we look into.
Thanks for getting us started, Akshay. And maybe staying with the laboratory a little bit, Robin, you run a large laboratory organization, and I know it means balancing operational performance with constant change. What has been the biggest leadership challenge you've faced over the past few years?
Thank you, Matt, and thank you for allowing me to participate in this panel. First, I'd say getting our people comfortable with being uncomfortable. Healthcare and the lab industry went from hero to zero post-pandemic, and we all knew that we were not going to be able to go back to delivering care the way we did it in 2020. So there's that uncomfortable space that our employees have to learn to be comfortable with. And first, our leaders need to be comfortable with that. So we've had to become much more flexible. be more innovative, to Dr. Patel's point, and move more quickly when it was appropriate. So I think the other challenges are balancing investment in automation versus giving raises versus holding cash for that inevitable crisis or instrument that goes down and you have to replace it and you hadn't planned on it. So I think balancing that is one of the key leadership challenges that we face now. Finding and recruiting skilled staff continues to be a challenge for everybody in healthcare. And so one of our areas of focus has been gaining clarity on which staff we simply need to raise compensation to be able to recruit and retain. And maybe it's even higher than market salaries would suggest in order to do that recruitment. And in other cases, can we create our own training programs, technical training programs, and apprenticeships? So gaining clarity on what it is that people's strategy from a staffing standpoint. And then I think this one's a pretty significant challenge. Many individuals in healthcare have gotten into a leadership role because they've been in healthcare for a long time. And with constant change, it does require re-education of the leadership and changing the mindset to be accepting of change. I think that can be a real challenge when you've had a leadership team that has been in place for many, many years. So that's been an area of focus for us. And then finally, and not the least, is developing and trusting in AI and automation and being very strategic about where we implement it so that we can minimize the risk associated with that.
Very good. Thank you. But actually, I'm going to switch order a little bit because, Philip, maybe you want to talk a little bit piggyback because as you've said to me, at least, healthcare professionals have experienced years of pressure and burnout. So share more about what are the most resilient organizations doing differently to support and retain their workforce to kind of give Robin, in response to some of Robin's challenges.
Yeah, no, thank you, Matt and everyone. I think Robin is heading in the right direction in terms of thinking about retention. But in my role, the most important thing that I'm doing, the most important thing that I think is really resonating with staff is just listening. People need to feel like you're listening to them. People need to feel valued. But also, one of the challenges that we've seen or that I've seen consistently in my work is like, after the listening is done, what does that feedback look like? What does that follow through look like? Because oftentimes staff, they're risking a lot to tell you about what they're seeing from their perspective, what's happening on the front lines, what are some of the things that they need to better protect the mission, the vision, and the values of the organization. And when they don't see movement, when they don't see visible action, I think that's when we start to lose people. That's when culture starts to shift for the worst. And I think, the most important thing that we can do is just be really transparent in terms of how decisions are made, how we're communicating to staff, what real visible change looks like, but also making sure that our managers and our leaders have the language, have the tools, and the support that they need to better be able to support the team, especially during times of transition. We're in the process of a big strategic plan under new leadership. And so it's really important that we continue to communicate, but also we have to create conditions where staff see themselves reflected in the future of the organization. We keep hearing over and over from staff, where are we going? Where are we going? Where are we going? So we're being really intentional in making sure that staff see themselves from every vantage point in the future of the organization. Again, I think one of the common mistakes that we make as leaders is that we listen, but there isn't follow through, there isn't clear, visible action. So I think all of that ultimately can impact how staff feel and how they show up to work.
Excellent. Susan, as I turn to you, I don't know if you want to comment a little bit more on that, or I have another question for you, but first I want to just give you an opportunity to comment on kind of the workforce angle, and then we'll get back to topics.
Yeah, thank you, Matt, and thank you for allowing me to participate in the panel. I love what both Philip and Robin have said about the workforce. One of the things that I think is really important as we kind of move into this new technological age with AI is that we hear a lot about nurses being brought in or frontline staff kind of being brought into some of those decisions that are being made after the fact, right? Like after the contract has been signed. And at that point, it's too late to make a change to the actual design of how it's going to work in the organization, to the things that you've actually contracted for. And so one of the things that I'm hoping that organizations will really focus on is increasing the data and the AI literacy for all staff, because they need to be real participants in where healthcare and technology are headed. And if they don't have that kind of baseline understanding, then they can't fully participate. So I'm hoping that there's real effort to educate and to elevate the literacy for frontline workers of all types, and then to bring them into the decision-making process when it's something that's going to impact their workflow directly. Because they have a lot to say, to Philip's point, that listening is really important. They have a lot to say about how work gets done in their particular care area or department. And so we need to educate, bring them in, listen, and then make sure we're making really good decisions in terms of, you know, new technology we might be adopting, or new policies we might be putting in place around those, new workflows we might be putting in place, that they can critically impact the success of all of those initiatives.
Can you give us a couple examples of the technology that's genuinely improving clinical workflows rather than simply adding complexity?
Yeah, I think that's a really good distinction to make, because we're in this, it feels like we're in this technology frenzy right now where everybody's really eager to implement new things. But, you know, there's a lot of technology that feels safe to implement on the operations side. I think on the clinical workforce side, we have to be very intentional as we're implementing things. And so there's a couple areas I think are really taking off successfully right now. And they're at a high level. They're the things that help us get clinical expertise to the patient sooner. They are things that automate some of that real low value administrative work that don't allow clinicians to work at the top of their license. It's also being able to like surface information inside the clinician's existing workflow so that they don't have to go somewhere else to get it and actually, you know, perform their duties. And so when I look at, you know, what's making something really successful inside a clinical workflow, at a very basic level, you could ask yourself the litmus test: does this technology reduce the number of steps between recognizing a patient need and acting on it? In short, if it does, then it's probably helping the workflow. If it doesn't, then health systems have to be able to say, like, hey, this might actually be creating some digital complexity. So I think there's three big areas that we kind of see right now that are burgeoning in the clinical workforce space. There's been a proliferation of things that are out there to reduce documentation burden and administrative burden. So these are things like ambient documentation, automated note generation, like AI assistance with coding support, even retrieval of significant amounts of historical information and kind of assimilating it into digestible documentation for clinicians. And these things are very successfully being implemented. The uptick is really high right now around these things. And I think healthcare organizations just have to ask themselves as they're implementing, does it return time to my clinician? And does it return cognitive capacity to my clinicians? If it does that, then they're relatively, you know, low risk as long as the ultimate decision lands with the clinician. A couple other areas where we're seeing some, you know, real good adoption is things that kind of close the gap between the clinical need and the clinical response. So it's, I would consider these things like more robust telehealth or virtual visits, certainly being able to expand specialty practice in rural areas. We're seeing it with virtual nursing coming in for documentation, admissions, med rec, things of that nature. And then lastly, it's that surfacing really important information in the clinical workflow so that it gets there at the point of care. But not all technology is created equally. So surfacing a piece of data doesn't make it useful. You need something that, integrates with the EHR, that it actually prioritizes. You mentioned I still practice in the ED. If you just surface a bunch of things that I need to know about all of my patients, that's a lot of work cognitively that I have to go through to prioritize that information. So things like prioritizing it, giving me actionable next steps, like those are areas where, again, I, as a clinician, still have the capacity to make the ultimate decision about how I care for my patients and where I spend my time. But they're relatively low risk, and we're seeing a lot of adoption in those areas. So I just say that it's an exciting time. We just have to make sure that we are really creating less friction for the clinicians. We're improving the patient's experience in terms of getting fast and coordinated care. And that on the organizational side, at the end of the day, we don't implement and forget to check if it's actually providing value in 6 months.
Yeah.
Well,
I just want to jump in, Matt. I'm sorry. I just
sure,
want to
please,
jump
Philip.
in and add a +1, Susan, for the importance of nurses. I just did a really important podcast on nurses as healers and leaders, and how oftentimes they get left out of the systems. Systems rarely change. It's the people that change the system. So, Susan, I really love what you're saying in terms that there's some limits around technology. And, I'm just reminded of that moment during my conversation when the nurse practitioner shared with me that there's a lot of knowledge there. There's a lot of care that happens with nurses on the front line that often get left out and sometimes disregarded when it comes to systems.
Yeah, that's a great point, Phil.
Thanks for adding. And Susan, I was going to say that I smiled when you were talking about like the whole documentation load, because I see a dermatologist once a year, and last time I went into his office, he introduced me to his laptop, where there was usually another person. He said, and I forgot his name, but I think it was Joe or something. Joe's going to take notes. Do you mind? As he treated me, and he talked to it like it was the same exact way he talked to the assistant that used to come into the room with him. So I think there's some advances, but I think you and Akshay both talked about focusing on value. I didn't know if anybody else, and Philip, you kind of chimed in there a little bit, but I don't know if there's any other comments before we kind of move on about kind of the focus on value that helps keep in line this change and implementing change. Any other thoughts?
I think there's also some unwritten value in some of the repetitive motion work, like in the clinical laboratory space. There's things that are repetitive, you do over and over and over again, and there's the propensity for you to kind of tune out and create potentially some patient safety concerns. And if you have some automation in that's taking some of that mundane, generic, over and over work away, it allows that clinician to work at the top of their credential, as Susan shared. And we've had staff come forward and say, you know what, I do the same process over and over, and it has no value to me, and I find myself in that mind-numbing space, and I'm worried about the patient at the end of the day. And so they came forward and said, can you find us some automation that takes this step out and makes me more efficient as an employee or a clinician? And then they get satisfaction. You reduce the potential for overuse injuries in the workplace and patient safety. You create more of a patient safety net there with automation at times. You have to test it, as Susan shared. You just one size fits all technology doesn't work. You really do have to test it out, make sure you're getting high quality technology and automation.
Yeah, Matt,
so Robin, that's actually a good segue, because and maybe that's one part of the answer to this question that I haven't read yet, which is And we've been talking a little bit about workforce and technology together, but how do you bring people with you through that change rather than creating resistance? You just mentioned, well, if it's for their benefit, that's one way. But any other thoughts about that?
Yeah, I mean, it's interesting, just in the context of our internal function and some of the daily habits within our organization. I'm starting to see a lot more technology show up. And Robin, I really love this notion of working to the highest of your credentials. If it support that, that feels great. But also, I think we have to be aware of the trap when, every email sounds the same or every report sounds the same. And that's why, I'm so grateful that, I was hazed in graduate school, so I had to learn how to write a thesis and support it through my doctorate. And so I understand that process. And so that tool, I feel like, thank you, Robin, for giving me the language. It really helps me work to the highest of my credential. But I am finding people fall into the trap of really using technology, for lack of a better word, just in a lazy way, and also careless, where it kind of gives you the veil of being efficient. But in actuality, there's a lot of things that we really need that human to human connection. And I think one of the most important things, working with an organization that's really mission driven, and one of our core values is relationships and the learning that we do, not only with our partners, but internally. So I would hate for that to be devalued because we think we found a shortcut, when it really is about people, it really is about learning, and it really is about that connection and those relationships.
Thanks.
And to piggyback onto Philip's conversation or comments, one of the things that we've done, because we are looking to lean our organization and be much more efficient, because our goal is to drive down the total cost of care and create efficiency, because our partners, our health systems that we support, are suffering from a financial standpoint post-pandemic. So we're looking at ways that we can improve the quality and reduce the cost and create satisfaction for our employees. And so what we've done is we're bringing them along in the conversation and explaining the why. I think the why is critically important. Why are we doing this? And then asking them for the solution. So they're part of mapping out current state and designing future state along with our process engineers. And then they're looking for automation when it's appropriate to fit into that workflow. And we're letting them drive the redesign. Now, there's leadership involved, obviously, but we have representation from those that would be impacted by the change or the workflow change or the automation or what have you, but bringing them along, letting them have the voice that Philip mentioned, sharing the why was critically important, and then helping them be part of designing the solution. I think that is how you bring people along.
Yeah.
And then we have the benefit of this current workforce that's coming in and that is here. They are all about technology, so that helps a little bit too.
Yeah, Matt, if I can check. Go ahead, Susan.
Go ahead, Akshay.
Well, I was just going to say, Matt, one of the things we are dealing with is a lot of innovations being applied. I know patient safety come up multiple times, and that's super important for us. If you look at the pathology, especially, AI and innovation can kind of look at the report and actually tell you what's wrong with you in most of the cases, right? So we are being very, very careful in terms of that. Still, pathologists need to look at it, sign. So I think as we navigate this ecosystem, we got to be careful that who is making the decisions, right? And what are the governance that we need to put on top of it to make sure those are safe and not being decided by AI, because those days are going to come, and we got to be, as in healthcare executives, we got to be careful when it comes to advocacy and making sure that there's a checks and balances. The second thing I was going to, on the workforce, I know some of my colleagues talked about, we are actually dealing with workforce also issues in terms of the J1 and some of the H1 visa, I don't know, Susan, you're dealing with nurse practitioner or not, but that's been a challenge. I know that's not the topic of the discussion today, but we are also kind of navigating that challenge to make sure we have appropriate workforce, because there's the shortages. that we are dealing with. And so AI actually kind of help with the shortages, but we got to be careful about to make sure that checks and balances. So we continue to balance that.
Susan, you want to add something too?
Yeah, love this conversation. I think everybody's had such great and valid points. One of the things I wanted to piggyback on what Robin said is one of the things that I see kind of happening sometimes right now within the healthcare sector is that we're so excited about the possibility of, all the technological applications of AI that people are starting with a product. And they're saying, it might be like, oh, our competitor's now using this product or this, this SaaS solution, or a board member learned about some great product, so they bring it to the table, or, whatever. There's a million ways you're going to find out about some cool technology, right? And I think that the organizations that do this really, really well are actually starting with a problem. And to Robin's point of, working with the people that are doing it every day, if you are a healthcare institution that understands the problems in your organizations as opportunities, and you scoped them out really well before you bring vendors to the table to address your problems, then you have it correct. You don't have the cart before the horse, which is what I think we're seeing sometimes. It's like, oh, we're so excited, so we're bringing vendors in. And listen, I work for a vendor. I love it when somebody heard about us from somebody else. But to implement just for the sake of implementing, I think we will end up spending healthcare dollars in the wrong places. But to work with the staff and to really partner with them to identify the problems and then bring the technology on to solve the problems is the way that we're really going to move forward in a very successful way.
And I do know from my own practice that there's not only this focus on value of how does technology provide value, but it's also risk. Like if you're just getting technology out there and you're not thinking through the risks, especially the unknown AI risks people don't have a lot of experience with, that you've got to weigh that as well. But I want to switch gears a little bit now and more on the leadership. So we kind of scratched a little bit at what leaders need to be doing in this environment, but I want to dive a little deeper, and I want to start, and actually I'll ask everyone on this question to kind of give your opinion, but I'll start with you, Akshay, with what are some practical lessons that have emerged from leading organizations through disruption, not necessarily just AI or technology disruptions, and I know your business and others have faced some unique challenges, but can you just walk us through, practical lessons that the audience can kind of tweak to make their own and apply to their lives as well?
Yeah, sure, Matt. Thank you. CAP is a membership organization, but we also do the accreditation and proficiency testing over 100 countries. So we actually ship the products, like, we send a live specimen, like, biopsy for the cancer patient as an example. And we ask the laboratories what they see, and we ask them to submit the results, data, and those are regulatory data we send to CMS. So we manufacture those specimens here in US, and we ship to over 100 countries. And going back to the disruption, Matt, with the geopolitical crisis in Middle East, we are not able to ship anything for last 3-4 months, and it's been a challenge because it just the type of, we don't send the pen and pencil, we send the live specimen, right? So it has a shelf life of 3-4 days, and it's not easy to ship. So I think what we are learning, to be very honest, through this process is like it felt like disruption is no longer an exception. It just how you operate in the today's environment. It just whether it's a cybersecurity or AI, Matt, you mentioned, or supply chain challenges that I'm dealing with, those are going to happen. We are not going to have control on Middle East war as an example, or so. I think a lot of lessons learned. So what I ask my team to that how we are going to build resilience before you need it, if you will, right? So next time when you are going to have this kind of crisis, we are prepared to deal with that, right? So that's what, and I think if you have to build the resilience, you got to invest into workforce that we talked about, some strategic partnership. We need to make sure that leadership understand, my leadership team understand that what kind of organization we need to create to deal with this kind of crisis. But yeah, there were a lot of lessons learned from my own experience shipping stuff to over 100 countries, and we are doing a number of new way of doing things, so when it had to happen next time, we are better prepared.
So when we've talked about innovation, we talked about more about operations or clinical, but I think innovation also applies, like you're saying, actually, I'm interpreting that to be innovation applies to resiliency. How do you think differently about staying resilient? Um, Anybody else want to take on the practical lessons from for leadership through disruption?
I would just add one thing, and I mean, I'm obviously looking at it through a specific lens of having implemented technology in organizations for the last, 10 plus years and kind of seeing where we're going. There is some uncertainty in the future. And I think that it's okay to communicate that uncertainty very honestly, as opposed to, communicating that we have the false sense of certainty, right? And the other thing I think is important in this disruptive time is that organizations need to be humble enough to say, we didn't anticipate that. We didn't realize that that was going to be an outcome. And in that vein, they really need to build good feedback loops and like the psychological safety that people can utilize those feedback loops, because that's the only way we're going to continue to like improve things, make positive changes as we continue to, layer on technology. So those would just be the couple of things that I would add.
Yeah. And
Philip
Susan, I'll
wants to
just
add to
add,
that, I'm sure.
yeah, because,
Yeah.
I think the challenge that many of us have is that we work with a lot of smart people. And if you're a smart person, it's hard for you to not be smart. And I think we're in an age where we're all constantly learning and evolving. And Robin, I think you said it beautifully, is that we have to create opportunities where people co-design and create solutions. And so right now, I think as leaders, we're programmed to fix, and fix. And so we're at a time now where we have to slow down, take a step back and say, oh, what are the things that I have to relearn and unlearn, and do that together? One of the things I love about my organization is that there's some incredibly smart people on the front lines who are part of the solution. So I'm oftentimes trying to create the bridge for leadership and staff to communicate. What are you seeing from your vantage point? And sometimes it's hard to work within those hierarchies, to talk across those power dynamics and really move folks towards solutions. So I think, again, it's really hard for, especially in the healthcare space, right? Where, oftentimes we get connected to our titles. So it's really hard to unlearn, to unlearn the things that we don't know, and to really trust that a collaborative approach will kind of guide us to the next level of the organization.
And before I ask Robin for her input, I just wanted to say, Philip, that I think that distinction between learn, relearn, and unlearn doesn't get enough energy out there, because the unlearning for sure, I think, is the hardest.
Yes.
And usually it's just like, okay, we can teach you the same thing over again. We can relearn, or yeah, you never knew this. But the unlearning is just not, I don't think it's, humans were actually given the gene to help them unlearn in general.
Yeah.
But so it's got to be a focused and explicit, straightforward dialogue, as you and Susan were talking about. I'm sorry, Robin, you were going to say something.
I know, Matt, I think that was perfect. The lead in mine is a little bit different. It's the kind of plus one, if you will. I think there's also an opportunity for us to have those candid conversations with those long-term employees and give them permission to leave. the industry. It may have gotten to the point where it's just too hard for them. They don't love what they do anymore. This is overwhelming for them, and yet they have this pride, and I've been XYZ for 27 years. I don't want to leave now, because they feel that they have to stay because that's what they were educated in. But helping them to have permission to do something different and explore new opportunities, I think that's a huge gift that employers forget to give their employees.
Yeah. I'm just sorry. I'm just taking notes over here. I feel like a student because, what that looks like from my perspective is that we have people holding on to the past. Oh, we used to do like this. Oh, remember when we used to go to Robin's house and we all got together? But like, hey, we're a virtual global organization now, right? We have to think in the future. And so I love the way you frame that, Rob, in terms of giving them permission to do other things, because there are a lot of people, I call it, who are holding on to the artifacts. Like, this is the past. Wasn't it so great? And in the meantime, our competitors are really leaving us behind.
I'm going to I still have some follow-up questions for the panel, but I do want to read a couple from our chat and see if we can squeeze those in now and then get back to our dialogue. I think some are relevant. The first one is, and whoever hits their buzzer first gets to talk. If you were joining a healthcare organization as CEO today, what would be your first priority for building a more resilient, future-ready organization, and why? Anybody want to buzz in?
I guess I
will question Matt. Yeah, go ahead, Robin.
Oh, Susan, go ahead.
I was just gonna say, Robin, that's a big question, Matt. I just gotta think on that for a second. So I'll defer to you, Robin, while I think on that.
I think if I were just joining, it sounds like the question is, if you're just joining now as the CEO, I'd have to do some assessment first to really understand where is the organization. Are they a move forward, fast forward, change agent, disruptor, or are they stuck in the past? So doing that assessment would be critically important first, because you don't want to come in and make all these assumptions that are wrong and then take the wrong move. So I think that would be my first thing. And I would take a chapter out of Philip's book, and I would listen. I'd ask probing questions of the leadership, the next level leadership, the front line, just to understand what the true culture of the organization is first. To do a lot of listening. A listening tour would be what I would call it.
Yeah. And I'll just add, it has to be people focused, people centered, because that's where your mission, your vision, they live or die at your staff's understanding of what's the next level of the organization. Because if you have people who are stuck in the current state and they don't see what the future state could be or any possibility. I love that, Robin. And I would pair that with some, let's think about the future, allow people to imagine, allow people to dream, like what would be, the most epic version of our organization in 10 years, and allow people to be creative and think outside the box in terms of the organization and getting you to the next level.
Yeah, Robin, I think I echo what you said, assessing the stage that you are getting into. I think especially the cultural aspects of what organization is and how fast you can move and the change you are going to make. So having that understanding will, as a new CEO, kind of make you aware what you are dealing with and how fast you can move and the change that you may want to make and how you can pace that out. So it's important so that's good. Yeah, assessing.
Does anybody want to expand a little bit for this question about the resiliency? So you just finished your listening tour, you pulled your thoughts together, and now the organization hasn't historically thought about resiliency, and you want to get them focused. So what do you do to kind of shift to that mindset or culture where resiliency is one of those key components?
So one of the things that I would just say, Matt, is I think it's important to understand that resilience is not just the ability to absorb unlimited change. Like sometimes I think that we think of resilience as like, if I can just cope with everything that's thrown at me, then I'm resilient, right? But that's not really a true and good definition of resilience. And so, and so I think as a CEO, you have to, like coming in, right, as part of that assessment, you have to understand not can we make change happen? Can we manage change? But what is the organization's capacity for change and ability to adapt to change? Because if the ability to adapt to change is low, then we really have to do some work to build that resilience within the organization, right? And the other thing that I would say, which is a related but maybe a little bit separate point, is at this particular time when we're layering a lot of change on, it's to Robin's point, we're still like in post-COVID world change. We're in this big technology growth perspective. And I think we really have to analyze things to understand that we're not looking for an exhausted workforce because we've just added a million things to the table. We're really looking at where we can be augmentative and subtractive, right? So whether it's Robin's workforce's repetitive tasks or things like that. And you have to evaluate both the organizational capacity as well as you're bringing things to the table, really assess, is it one more thing that exhausts my workforce? Or are we redesigning workflows? Are we redesigning job titles and roles so that we're making this kind of a new, to Philip's point too, like we're reimagining the future, which I think does help create resilience in the long run. I hope that made sense.
Oh, absolutely.
Yeah.
Okay, I'm going to move on to another question from the chat. It is taking us a little closer to the technology question, but I do want to be responsive to them as well. What would be the biggest challenges to the implementation of new technologies in the healthcare sector? So this is you can drive a bus through this problem because it's big.
Yeah,
but anybody want to? I see Akshay.
Yeah, I can take a step. I mean, I'll tell you my point of view. We have a lot of technologies that implementing the technologies never been a problem. To me, it's always a leadership challenge to me. That how do you really align people and innovation that you are about to implement and other cultural aspects to a common purpose, if you will, right? So I have seen if you can get all kinds of technology right now. I have 200 plus technology in my shop, but when we about to implement the new one, you got to make sure that while we are bringing that change, what this is going to do to the organization and aligning people to that common purpose and make sure it's the right thing to do is more challenging than actual technology implementation, right? So the change management part is the one takes a lot of our time, in my opinion, because if you don't spend the time there, people aren't going to buy into the change. So there are always challenges about particular technology you are implementing, but I see more challenges adapting and making sure how we navigate through the change management part. That's how I have experienced more. So we spend actually good amount of time in change management, making sure people are aligned with the technology change in this case that we are bringing.
So here's another twist on that same question, a little more specific, and maybe somebody else wants to. As a healthcare organization, how would you make sure your members, patients, are comfortable in using new technology, especially AI tech?
We do a lot of math, since I'm going to continue. We do a lot of education for AI to our members, because and we kind of teach them that treat AI as your colleague. Don't look at your competition. And we have specific education class for them to really make sure don't shy away from AI, just embrace, and because if you are going to do that, you will be forgotten, if you will, right? So we have specific education class and other training to kind of prepare them to deal with AI as AI being implemented in their hospital systems. But yeah, I think you got to work with AI. You got to look at AI as your colleague, as you're working with your colleagues. So those are some of the things that we do to with our members to make sure they are prepared.
Anybody else? Any
I would just
thoughts?
say, from a patient perspective, I've seen, just Matt, you mentioned that your physician came in and, got your consent in a really conversational way to have that AI scribe. I think there are ways that we can incorporate it in and kind of educate the patient about some of the technologies that we're using.
Yeah.
One of the things, though, that I think we have to be really cognizant of, it goes back to kind of like healthcare literacy, right? And we present information to patients in a lot of different ways to kind of meet them where they're at from a healthcare literacy perspective. And so you're going to have the same thing that happens on the technology side. If we're, like pushing patients to consume information in their patient portals that maybe have, AI recommendations for their wellness, things they need to get done, or education, or things of that nature, we also have to be able to recognize that not every patient is going to consume information with a verve for technology. And so we still have to push forward to engage with our patients using technology in better and more comprehensive ways. But we also have to allow for traditional means for patients who aren't going to march along as fast as we do.
Yeah. Susan, I'll just echo that. I'm from a rural part of North Carolina. I think there's a cultural competency piece as well in terms of habits and traditions. My dad had a doctor that was, under 35, and that freaked him out. So I think, where's the doctor? Where's the real doctor? So I think when you add technology to that piece, and again, there's a literacy term, a technology literacy, that's the barrier as well. So I think there's a lot of cultural things that we really need to take into consideration when you're trying to make those connections, when you're trying to make technology accessible, because, my folks are like, nope, I want to speak to a doctor. No, I want to speak to a doctor. Like, they want an actual person there, and they don't. My dad unfortunately passed away, and I took my mom. I said, Mom, we need to get all your bills paid online. And she's like, what if the internet breaks? So there's that real fear of technology that you really have to meet people where they are. And I don't think the AI alone can solve that. It goes back to those relationships that we talked about.
Absolutely. So go ahead, Adam.
Sorry, I would just add, I watched one of the provider groups that we work with. They went to a kiosk check-in at their clinic, and they just did it overnight. And they just put this iPad in front, and I just watched the patients freaking out about it, especially those that aren't comfortable with technology. They didn't know what to do. They were paralyzed by it. Instead of introducing it as an option, I love the option comment, because meeting people where they are is so critically important. But having the option to do the kiosk or the traditional receptionist at the desk, and then maybe have the receptionist teach that person how to use the kiosk if they're interested. I mean, that would have been a simple solution. The person was already could have been there. It just that's failed implementation. That's not thinking about the customer experience portion of it, which is often overlooked.
Yeah. So we're winding down on time. I'd like to do a round robin. You each get a minute about, and this is the question, if you could recommend one practical action for healthcare leaders should take over the next 6 months to strengthen organizational resilience, what would it be? And I'm going to preface it by saying you've all emphasized the point of kind of fit situation, figure out where they're at, what they're doing. So you've got to kind of make some assumptions in your response. What's high up there on the list in terms of an action, a practical action leaders can take over the next 6 months to strengthen organizational resilience? I'm going to start with Philip, please.
Of course, you had to start with the people guy. No, I think it goes back to what what we were saying earlier around change management. I think we're at a really interesting point in time in terms of healthcare and technology and people and merging and finding the intersection, that sweet spot where we're all, I think someone said, we're all partners, right? And so how are we going to coexist? So really investing in the learning and the tools and giving people the resources that they need to work better across those different domains.
Thank you. Akshay, your thoughts?
Yeah, my thoughts, maybe two-part. I would say one of the action is to invest in your people and build a culture that is ready to embrace change. And I'm dealing with a lot of disruptions that we talked about, and there are a lot of lessons learned, and so I have to kind of build the team and the culture that ready for future crisis, and ready to make sure what kind of change we need to make. So right now, that's a one thing, that there are things that you don't control. Things are going to happen. So creating the culture and make sure we have the people at every level who are ready to embrace change, and looking at that future crisis and making sure that company is moving into the right direction. It's super important.
Okay. Susan?
So I would say that, when we think about organizational resilience, it's really the action of having just repeated evidence that the organization can learn and improve. It's, it's not necessarily, I know Philip's working on a strategic plan, they're important, but it's not, through a strategic plan that doesn't feel like a lived experience at the bedside level. So if I could say do one thing in the next 6 months, I'm going to tell that leader to go work with a unit, find a pain point, map it out, figure out, where there's breakdowns in the work, where there are workarounds, where is there disruption in handoffs or safety or patient experience or quality, and work with them to redesign that broken problem and lift them up, empower them. And that's one more time you've provided evidence that this organization can learn and improve. And when you start doing that over and over and over throughout the organization and really get people's buy-ins and build those relationships, it will just increase your organizational resilience.
Great answer. Robin?
I don't know if I can top that. Thanks, Susan. Actually, I think if I tie what everybody said together, be transparent, explain the why, share what's in it for them. You gotta explain what's in it for them, that value, to show that they have value, and then invite them to help design the future, including your resistors, because that's who you need to win over. And if they're part of the design work, they have buy-in into it. So I think I'll just leave it with that.
Well, that's great. And that's a great way to end, actually, too. So I want to just remind the audience that both a replay of this and key takeaways will be provided to all the audience. And I also just want to say thank you to the panelists. I think you guys did a great job today. Thank you for the attendees. We had some really good questions. And thank you to the Global Advisory Alliance for making this happen. Make it a great day, and thank you, everyone.